Hello and welcome to our lectures today on respiratory physiotherapy for ICU patients. In our last lecture, we talked about the roles of physiotherapists in the ICU, which we classified under respiratory care and rehabilitation. So today we'll be going in details about respiratory physiotherapy for ICU patients. Before we go further, we need to quickly take a look at the anatomy and the basic physiology of the respiratory system. The respiratory system comprises of the airway, the lungs, and the musculoskeletal structures of the thoracic cage. This system works to maintain oxygen supply to and removal of carbon dioxide from the body. Respiration involves the exchange of gas between the atmosphere and the lungs and the blood, as well as between the blood and the body tissues. One of the major dysfunctions that is witnessed in ICU patients is respiratory problems. Most times, ICU patients may be bedridden. Some of them will come down with complications which is associated with prolonged bed rest. So, the failure in any of the components of the respiratory system can result in the need for respiratory support. ICU patients are always at risk of developing complications such as secretion retention, atelectasis, ventilator-acquired pneumonia, decreased lung expansion, increased work of breathing, ventilation-perfusion mismatch, inspiratory muscle weakness, and weaning failure, as well as other complications that can arise in the ICU. So what do physiotherapists aim to achieve? First of all, the physiotherapists working in the ICU, as much as possible, want to maintain the airway patency of a patient in the ICU. They want to improve the lung inflation. Most time patients in the ICU, they can come down with collapsed lungs. They can come down with problem of thoracic expansion. So the PT wants to either prevent or wants to manage these complications when they are setting in. Like I said before, you want to maintain the airway patency by as much as possible clearing the secretions in the airway. You don't want any reduction in oxygen supply to the body. So one of the things that can lead to reduction in oxygen getting to the lungs is due to secretion accumulation within the lungs. So the PT, as much as possible, will try to clear airway secretions. The PT wants to reduce work of breathing. If, for instance, the airway is blocked by secretions, the patient invariably will begin to gasp for breath. And when the work of breathing is increased, it will definitely increase the metabolic rate of the patient. And when all this happens, it will lead to reduction in the amount of oxygen getting to the lungs and also to the body tissue. Also, the physiotherapists working in the ICU want to always enhance the inspiratory muscle functions. For a patient who is intubated, depending on the mode of ventilation, you will discover that this patient will be supplied, oxygen will be supplied to this patient via the ventilator, while the inspiratory muscles becomes dormant. At that point in time, when the inspiratory muscles become dormant, the next thing you will expect to happen will be the weakness of these muscles. So the PT will carry out some therapeutic maneuvers to enhance inspiratory muscle function at all times. Also, they want to promote recovery of spontaneous breathing, especially for ventilated patients. You want to, as much as possible, reduce the length of time spent on the ventilator. You want to enhance weaning process. You want to get the patient to be able to breathe again without any support. The PT wants to optimize oxygenation. To optimize the oxygenation, some of the aims that we talked above comes into play by improving the lung inflation, by clearing the airway, by reducing the work of breathing. As you are doing that, you want enough oxygen to get into the lungs. So when you are doing that, you are invariably optimizing oxygenation. The PT also wants to prevent respiratory complications in both the intubated and spontaneously breathing patients. So, this is to say that respiratory care in the ICU is not just for a patient who is intubated or a patient who is spontaneously breathing. The PT has a role to play in both spontaneously breathing patients and ventilated patients, because you don't want any complication to arise. One thing with ICU patients is they have conditions that can decompensate. You can see an ICU patient who is doing well within this minute, and in the next second, the patient is deteriorating. And as much as possible, you don't want this patient to die under your care in the ICU. So you have to prevent any complication. You have to anticipate any complication that might set in as a result of that critical illness, and as much as possible, plan care that will help to ameliorate the situation. So we are going to quickly look at some of the modalities that physiotherapists engage in managing patients in the ICU. There are several modalities that PTs employ in order to administer adequate care and treatment to patients in the ICU. Some of those modalities are listed here, which are manual hyperinflation, ventilator hyperinflation, positioning of the patient, incentive spirometry for patients who are responsive, for patients who can obey instruction, for patients who can actually perform those tasks, non-invasive ventilation, airway suctioning. We talked about one of the goals or the aims of PT is to clear secretion from the airway. So when PT must have mobilized the secretion utilizing various modalities for treatment, they will carry out the airway suction in order to remove any form of secretion that has been mobilized to the central airway. We can use forced expiratory maneuvers such as cough, coughing, or huffing. You can use percussion. Also, continuous positive airway pressure, CPAP. We have machines for some of these modalities. Deep breathing exercises, which you can teach the patient to do or to perform on their own. Positive end pressure, end expiratory pressure. Also, postural drainage, which the PT can position the patient in some gravity-assisted positions, so that gravity will help to drain some of the mobilized secretions in the airways. Different manual techniques, insufflation, exsufflation. This is done utilizing an insufflation, exsufflation machine. Also, PTs can nebulize the patient. When there are thickened mucus within the airways and you want to get them all out of the air from the airways, you might want to nebulize this patient, either using any of the nebulizing agents to be able to soften the mucus, so that when you perform your maneuvers, these secretions can be removed from the airways. So these are some of the modalities that PT utilize in managing patients in the ICU. In our next lecture, we will start looking at these modalities one after the other, so that we can get to understand how these modalities are used, the indications for these modalities and some contraindications for these modalities. In knowing some of these things, we will be able to plan adequate treatment for our patients and also be able to administer adequate treatment for our patients. Thank you for listening. We'll see you in our next lecture. Thank you.